Discrimination and racism are undercurrents within our healthcare system, but change to how we train the healthcare workforce has been slow to happen. As a Black woman who grew up and currently lives in urban America, I care about how the healthcare workforce is trained to support the communities I represent. In fact, I was recently honored with the 2022 Justice, Equity, Diversity, Inclusion, Civic, and Community Engagement Award by Transform Mid-Atlantic for creating a structural racism curriculum for medical students that centers the voices of community residents most impacted by implicit bias and racism in healthcare. And the last thing I expected to happen to me on the day that I was to receive this award was to be confronted by the police in my own dentist's office. When the treatment coordinator came in, we had an exchange about the kind of procedure I would be having done. Things took a turn when she said that this procedure needs to be paid 80% before we can start. I thought, what? That was not what I was told through multiple forms of communication with the office staff. You knew that before today, so why am I just learning this while I'm seated for the procedure? She responded that she couldn't answer that, and when I asked to see my doctor, she said, no, you need to talk to me, and I also don't like how you're talking with your hands, so I'm going to end this conversation now. I was completely shocked at what appeared to be a sudden change in tone and disposition. She continued on while walking toward the entrance. You can collect your things and follow me out. I demanded that I speak to my doctor before leaving. At this point, the coordinator decided that the most appropriate form of action was to call the police. I hear through her phone, 911, what's your emergency? In this article, I share more details about my recent experience and how I sustain myself as an advocate for change within the healthcare system to address bias, discrimination, and racism. My lens will not only be as an advocate for racial justice and health equity, but also as a Black woman who has experienced firsthand what many minoritized patients experience when they interact with the healthcare system.